Hey guys, Don here. Welcome to Podiatry Practice Mastery. Going through I call it the $1,000,000 minute. And I'm going to go over the patients here. So my goal is to, in this, kind of just give you some ideas, kind of what's working for me in my practice and how we've kind of gotten to the $1,000,000 mark. A couple of other things that I was working on today. One was I was sending a letter. I got a referral from a chiropractor. So what I usually do is when I get a kind of a new referral source, I'll try to call them just to kind of get them on the phone, make friends. And then I sent them a letter. So I just sent them a letter. I created it actually with AI this time. And so I just had AI create me kind of a letter. And I usually have these in Google Drive and in a folder. And so if I just want to just copy one to make another, that's kind of how I do it. So I sent that out. Also, I'm kind of working on a comparison for EMRs, just so you know. I'm trying to work on, we're thinking about switching, and I've talked about this before, switching from Athena to ModMed, and they're kind of chasing after us. So Athena now wants another meeting with us to see if we'll stay, and ModMed will to make it a little bit more objective. What I've done is I made a little a spreadsheet on Excel. So it has the, kind of the numbers that we're using, kind of different scenarios like ModMed 1, ModMed 2. So basically it's how much they charge per month per provider, and then the percentage rate, and then kind of our production, how much we're producing for the practice. If you want to see that, you can just probably easier just to send me an email down at podiatrypracticemastery.com, and I'll send that over to you. Okay. And then finally, we did decide to hire our nail tech. We are struggling to try to find a nail tech to help us. We did find someone, and this one she seems a little bit better. We're on like nail tech number 3. So if you're thinking about hiring people like a scribe or a nail tech, it's probably better just to get started versus like trying to get the perfect first person. You have to kind of get the process down, because you kind of suck in the beginning until you get enough reps in. Okay. So anyway, let's go into the day. So first patient was a Lamisil follow-up. Didn't really see much improvement, so I switched that patient to diflucan. That's kind of what I used for the second round. So that was a higher level visit because of the medication management. There was a surgical consult. I have a couple of surgeries scheduled for next week. So this is going to be a bunion and Taylor's bunion, and she also wanted some hardware removed on the other side, so we're going to be doing that. That was a level 4 visit. The reason I do level 4 is because I'm doing, surgical consult, but as well I'm doing medication management, and I pre-send those. So surgeries are always Wednesdays for me, so I send it over a few days before, and so it's post-dated in my medical record system, so I can send it, but it doesn't show up for a few days later. That's kind of how I do it. Next, there was a patient that came in for follow-up on nail fungus. Now, she got pregnant. She had to stop her medication, so I put her on a Formula 7. I know some people use Formula 7, some use Tosolin. I don't know if any of them work great, but this is just the one that I have that I use. Another patient came in for callus care, kind of simple one. Newer patient for plantar fascia pain. So I did my whole plantar fascia number 1. So if you know what that is, it's my night splint, foam rolling, morning stretch, along with a meloxicam that gets me the medication management. And then they'll follow up in 3 weeks for an ultrasound. Another patient come in for a follow-up after heel pan. And I started him on SoftWave. So he is going to be doing, I did SoftWave number 1, and I'm going to schedule him for number 2 and number 3. And I think this gentleman actually is for the second metatarsal, and I did an ultrasound last time. That's why I didn't do it this time, and I just did the SoftWaves. Okay, radial only for him. Another patient that came in for a booster. So the way I do my oral, I do 3 months Lamisil, then I do a 6-month follow-up where they do a booster, which is a lower dose, for about 6 months, and then back to the normal dose. And then at that follow-up, then I'll put them on some ketoconazole on the skin just to prevent any recurrence. So that also gets me medication management because of that other medication that I'm switching it to. So he had great results with his Lamisil. Quick matrix follow-up, then EPAT number 2 for metatarsalgia for this other patient. A new patient came in for peroneal pain. I got x-rays. And this patient, and I did an x-ray and ultrasound for her. She came in as a second opinion from a physical therapist. So they're planning on doing SoftWave for her. So SoftWave, I don't have that machine. I have ShockWave. I have the CureMedics machine. But I've heard good things about it. And so what I did is I referred them back to PET. I said, yes, do the SoftWave. And if that doesn't work, have her come in for either an amnio or an orthotic to stabilize it. She has kind of a high arched foot. And so I think an orthotic would benefit her. I think amnio, because I did show her where the tear was on the ultrasound. So we'll see how it goes with the SoftWave that she's going to do. Another new patient came in for posterior tendinitis, and gave her the whole meloxicam. She had pain to the navicular insertion. So I did a cortisone injection with a walking boot, and she'll be back in three weeks. Another patient that got x-rays on just came in for edema, and I just didn't do much for that. And I talked about that, and I'm not going to see her back. That was the morning. Afternoon, simple nail care patient. Swift number 2 for another patient. EPAT number 3 for a patient with Achilles tendonitis. So EPAT number 3 always gets an office visit, and then I do, it was a 2-month follow-up for this patient, and she'll be going to physical therapy. Another patient that came in that had some nerve pain. This was a new patient, and had some sesamoiditis on the first metatarsal head. So I gave them meloxicam, kind of offloading of the area, and I recommended ultrasound and EPAT. And they're going to kind of think about those options and then follow up for that. Another patient came in for Achilles pain, and they were getting orthotics that day, and I'm going to see them back in 3 weeks and do an ultrasound at that time and possibly some SoftWave. Another patient came in for a diabetic foot exam, see them back in a year for that exam. Another new patient with foot pain. This patient had previously seen some other people. I got an x-ray, got an ultrasound. They had pain to the first metcuneiform joint, and I did an ultrasound, and I injected it and showed her where the arthritis was, and then she'll just come back as needed. Another patient that came in just to review nail sample. So when I get a nail sample, I have them review the nail sample in 3 weeks. If it's negative, I still just say it was negative and don't do much. I would kind of figure out a way to avoid those. I'm always thinking about canceling those, but I did review the results with them. Another patient came in for a Lamisil booster follow-up, and once again, I gave them the booster, which means another dose of it at a lower dose. Then she also had KeryFlex bilaterally because she had one previously and she liked it, so she had to buy the KeryFlex and the kit, and that was a 6-month follow-up. And then there was another patient that came in with bilateral ingrown toenails and kind of took care of those. And then finally, the last one was a Lamisil follow-up, and I gave them ketoconazole as well, which was medication management as well for that to prevent any issues. So that was the day. It was kind of a busy day. So I guess probably the MVP was probably that Lamisil booster with the KeryFlex, because I'm not really seeing many orthotics this day. Anyway, if you found this beneficial, let me know, and if you want my thing to compare EMRs, just shoot me an email. Thanks.